How do you get rid of ads that come across the screen if there's no X?
Ads.
You're getting adverts now.
And I sent an email to PetSmart about something, and now I've got a quarter of my page.
Oh yeah, yeah. That you can't get rid of it. It's forever and ever.
Oh, thanks, Partner, thank you. So I'm never going to PetSmart again.
Yeah, just be careful what you search for.
Honestly, I'm not doing it again. It's just, yeah, it's a lesson.
One time I got one that kept popping up for a knee brace, and I wondered why I was getting a knee brace, and then it turned out my husband had logged into my laptop, and that's why he must have been looking for a knee brace because his knee was hurting.
Yeah. No, it's not worth going in online. It's honestly not worth it if I'm going to get up.
Great to see so many people that I haven't seen for a while. Hey, Julie.
No.
Oh, there's Marion Westenberg just coming on too. Hi, Marion.
And Catherine Smithron.
Hello.
Oh, Catherine's there too. Hey, Catherine.
Hi.
Never been in a Zoom meeting with so many people that it's 2 pages.
I know it's good. Here's Marion. Hello, Marion. Welcome.
Hi.
Happy wedding anniversary. That was awesome to see that in the paper.
Well, that's a long time. Can you hear my voice?
Yes, we can hear
Oh,
you.
good. I'm glad.
Yeah.
I'm at our apartment, and at home my mic doesn't work. So here I'm good. Fine.
Very good.
Wonderful. Let me see who's here. Oh, lots of friends. Nice. Very good. So, is there still time to go? Does anybody have a drink there? No, none of you.
Yeah.
Is that social hour?
It's fine.
Oh, good. Good.
Yeah.
Is there still tea? Is there still time for me to grab one? But I'm going to grab a cup of tea. Full time, huh? Yeah.
Yeah, we're about to start in a minute or so. Yeah.
Yep.
Yeah. Hey, Kim Peachy.
Hello.
How does this compare to your turnout last time? I missed it.
It's about the same, I think. Maybe we had a couple more, but I don't. About the same, I'm thinking.
Right.
Yeah.
Hi, everyone.
Yeah.
Oh, hi, Leanne. Hey, James. Oh, there she is. Hey, I had to page over.
Yeah, it doesn't sort by alphabet. You have to kind of hunt people out. There, Marion's back.
Nobody's wearing a mask, but I had to show you. So, you know, I wear a lot of animal print. My teenage son bought me these for Christmas.
Oh.
Match my shirt.
That's the next fashion trend.
What is? Oh, different masks.
Yeah.
We'll be wearing them for a little while yet, I think. This afternoon, I was in a little course at the senior center, and the girl next to me had one of these blue ones, but she had turned it over several times so that it would fit better, but there were 2 big holes on the side. I could have blown from one hole out of the other, but I didn't want to tell her, so I don't know. But straightforward, she was fine. Hi, Catherine Manley. Nice to see you all. Julie.
Hi, Marion.
Catherine.
Unless there's another Julie.
Sue, my goodness. Lucille. Linda Ann. Oh, I know so many people. Oh, that's Megan. Megan, I had you on the phone 2 days ago, but I didn't know the face to put with it, but now I know.
Yes, nice to meet you in person.
Hi. And you all see I've grown gray. When you saw me the last time, I still had dark brown hair.
It looks
Big
great.
white parting, with a big white parting. No more of that. So,
Jessica, whenever you're ready, I think we've got most people.
Okay. Hello to everyone. It's my distinct pleasure to welcome everyone to the first Women United Zoom event of 2021. Last year presented new challenges and obstacles to the entire world with the onset of the COVID-19 pandemic. While the Women United initiative was not exempt from the challenges and obstacles presented, we continued to adapt and grow. Women United saw an increase in numbers from 269 in 2018 to 305 in 2020. As we continue to grow in number, so too do the funds raised, our educational awareness pertaining to the issues facing our community, and our ability to share that information with the community, thereby increasing our partner agencies' abilities to continue to serve our most vulnerable. Today, we have a wonderful panel assembled to talk to us about the impact of COVID-19 pandemic on mental health through the unique lenses of their organizations and their personal experiences. So without further ado, I will turn it over to Pavna to introduce our panelists.
Thanks, Jessica. I would like to thank Jessica and Jane. It's been great working with them. They are the co-chairs of Women United, and they came at a time when we were pivoting and changing, and it was great to have them and the entire Women United committee. So thank you all very much. I wanted to thank everyone around the Zoom call, around the room. I'm not sure if you know, but last year, thanks to your support, the United Way supported 220 programs that helped 76,000 people in our region. We invested 5.5 million, which really is a record. It was thanks to United Way funds raised, it was the COVID fund, it was some federal funding that we were able to steward, but it was just amazing to see our community come together and for us to be able to support agencies at a very difficult time. So today we're going to talk about an issue that all of you have, all of us have seen rising, increasing, mental health. Not an easy topic because it's certainly, it varies. So we're going to talk about three different aspects. One is we've seen vulnerable people, and our agencies will talk about, sorry, there's a little sound feedback.
I think Pavna, somebody needs to put themselves on mute.
Yeah, Megan, can you just mute whoever's not able to mute? So one of the things that we talk about three different aspects. So we know that some people have been facing the impact of mental health for a long time, and we have our agencies today. So we have Addictions Mental Health. We'll talk about the most vulnerable. They'll talk about how mental health ends up with homelessness, with all kinds of issues, and we'll talk about that a bit. We also know that many people in our community have been running on fumes, as was expressed in a Globe and Mail article. We've just been running for so long, we're tired, we're facing stress, anxiety. So we'll talk about that. Also with the lens, remembering some of the agencies who've been dealing with this. On March 13th, when we had the lockdown last year, many of our agencies just had to go to work the next day and find different ways to serve their clients because the needs were not going away. And the needs have grown over time and our agencies have adapted, but at great cost to the mental health of many of our service providers. So with us today are a couple of people from Resolve who will also talk about some of the impacts that we're seeing in our agencies. Our agencies are burning out, they are tired, they're exhausted, but they can't stop. They've also seen a decline in the number of volunteers they're able to use because many volunteers are not able to work in small spaces, or they're seniors, or they're vulnerable, they have some health issues. So a lot of agencies are doing so much more with so much less. And what's really amazing is that, again, as a community, you've come together to at least help them with one thing, which is finding the financial means to deliver their service. They still have to find the nuts and bolts and adapt their services the way they have to, But at least one thing we've taken off their plate is they know that they can turn to us as the United Way, as our supporters, to help them when they need help the most. We'll also talk a little bit about the impact that mental health is having on children and youth. And we have a quick clip that will show you. Jen Cameron, who's on the call, has done a brilliant job of adapting our Success by Six and Youth Homelessness collateral to really help us talk to children and youth who are facing mental health. And we're hearing more and more from our agencies about the significant impact of that. And we'll talk about youth as well. Our agencies will talk about that. I'll just cover a couple of, normally we tell you where the washrooms are and where the fire exits are, but in lieu of that, what we'll tell you is this is informal. So feel free, keep your cameras on, keep them off, raise your hand if you can't hear me. I tend to talk really quickly. Val taught me to just tell people to listen faster. So just listen faster if I'm going too fast, or raise your hand. You can use the chat box at any time. We'll go through the 3 presentations of the agencies and the children youth mental health, and then we'll open up a Q&A. Lori Ross and Kim Hockey will facilitate that. So feel free to add your questions right through. We don't expect you to hold them in your mind till the end. I know I forget. So feel free to add them as you go, and they'll collate them and make sure that your questions get answered when we do open it up for question and answers. So thank you for that, Lori and Kim. And Leanne O'Mara, who's our board chair, will talk to you a little bit about how you can help the community in one more way about Tampon Tuesday. So we'll go through a lot of things today. But in the meantime, it is my pleasure to introduce you by video to Rhonda Candy from Martha's Table. So Jessica or Megan, will you start that now? It's
pre-pandemic, we provided breakfast, lunch, and dinner, and a social center where people could relax. And we really promote inclusion, safety, provide access to nutritious food, and an opportunity to make vital connections and friendships within the community. So I've been with Martha's Table since 2008, and I've gotten to know so many of the people that frequent our facility. And it's often the best part of my day is when I get to chat with people and get to know them a little bit better, because we serve the most vulnerable populations in the city. Many are negatively impacted by stigma or discrimination that's attached to mental illness, and it presents barriers not only to treatment, but also to acceptance in the community. And that's where we really focus our attention to reduce stigma and to give people a place where they're welcome. So I don't have any formal training in the field of mental health. So I'm speaking today really from my personal experiences, and that's, you know, at least 15 interactions per day for the last 12 years. So we have had some hands-on experience here. I find success in most situations, which we hope to end up with the individual feeling better about themselves and their situation, is to let them know that they are in a safe place, free of judgment, and that they have options. And those options, which really include them connecting them with professionals at other agencies, people that have the expertise and experience to help them through their situation. And also simply listening to them as they outline their struggles. So being respectful and approachable, patient and understanding as well. So, I mean, we all really want the same things, right? We all want to be, know that we're safe, we're welcomed, and we're heard and we're understood. So it's universal. So while in general, the vast majority of our guests struggle with varying degrees of mental health challenges, some Canadian statistics are by the age of 40, 1 out of 2 have experienced mental illness. Mental and physical health are linked. And again, we've tied food and social together because of that. But 20% of people with mental illness have a co-occurring substance use problem. And we also unfortunately see that in our environment too. People with serious mental health conditions are disproportionately affected by homelessness. And I've witnessed that over and over. There just aren't enough supports available to help people remain housed And often people just aren't aware of how they should be interacting or what the best approach is. And I can certainly appreciate that, again, without formal training in this field, because there's so many varying factors. Row here at Martha's table of who we've served, staff members were stretched to make those personal connections and offer assistance. So we were really pleased to partner with United Way and offer access to a social support worker, someone that is trained and has experience behind them that will help them connect in the community and with supports as needed. We hope that they would feel comfortable already in the space that they're familiar with, and sort of streamline and speed up those bridges to a better future. So without United Way support, we couldn't have offered that. And we had that for 2 years. And I can tell you, it gave us relief as staff members, because we're very aware of not giving people incorrect information or advice. We listen, we care, and we try to steer them to professionals. So this was relief for everyone on staff here, but I know for sure that we had 2 suicide interventions at least. So someone had expressed to the counselor that, they were thinking of suicide and they had a plan, and this was prevented simply by having someone on site. So vital. This is just life-changing for so many people. For us here at Martha's, it's a very demanding environment, but we get to know people and we get to offer them nutritious meals that we hope helps them keep a little bit healthier. And we appreciate the opportunity to get to know them personally, and we just hope that they move forward in a better way. I've been with the organization 12 years, and it's the best place I've ever worked, and we work at it every single day. So it's a great community to be in. So thank you for the opportunity to tell you a little bit about our challenges and our successes. And I think mental health is a serious challenge, and I'm glad we're talking about it so openly today.
Thank you. So again, the tie-in mental health with everything else, all the other issues. The bulk of the issues that our agencies address every single day, 365 days of the year, usually has some tie back to mental health. So with us today are Carol Ravnas, who's the Executive Director of Clinical Services, and Julie Lambert, who's a Program Director with Addictions and Mental Health Services. And they see firsthand, they really see the most vulnerable people, and they do an amazing job. Their team does an amazing job helping people on the streets, in shelters, with agencies. So I'm not sure if Carol or Julie, who's going first.
Hi, I'm Julie Lambert, and I'm a program manager here. I manage the case management team, the intake team, and the criminal justice team. So what I thought I would do is just give you a story, 2 client stories of 2 of the positions that are supported by the United Way. I have an outreach nurse and a youth case manager. So I just tell you a story about 2 clients that we've serviced through United Way funding. The first is a female client that was identified at Bell Park this summer through our outreach nurse. She was going out into the community and just slowly connecting with clients that were traditionally very hard to service, probably fearful of our system. And she was just going with a coffee, taking a look at wounds, and just slowly engaging them into services. While she was there, she noticed that this woman had signs of COVID and offered her to come to the isolation center to be tested and isolated and stay for a few days. While we were there, her mental health was very poor. She had high addiction use. Her diabetes was unmanaged, and she was chronically homeless, had many charges against her. She had been cut off by social services as well because she had applied for the SURF benefit and she didn't qualify for that. So she was taking double income. So they cut her off from that, from her social services plus her drug benefits. She was using the ER almost every day and had daily police contact. So we started to engage with her at the isolation center through the nurse. And upon discharge, the nurse continued to reach out with her pretty much daily and was able to develop a life care plan with the hospital to help reduce the ER visits. And then was able to work with the hospital to get her on a monthly injection for her mental health, and where the hospital was able to cover and is still covering the injections cost until we get her social benefits straightened out. So she's doing much better. When we first met her, she was extremely thin. She's now at a healthy weight and she's managing her diabetes much better. She's been assigned a case manager that she meets with regularly. Her drug use has decreased and she's actively engaging in the harm reduction teaching methods. She currently did find short-term housing right now, so she is housed, which is fantastic. And she's no longer going to the ER, and she has no police contact in the past few months. Just recently, we did have her back at the isolation center because of a potential contact with a positive. I hadn't seen her since the original time we had her there. You wouldn't have even recognized her, how much better she's doing all around. It's just fantastic. And she's continually working to decrease her addictions and trying to get into detox. And that's just through our outreach nurse, just engaging daily, taking a different approach to connecting people with services, going out and meeting the person where they're at, just slowly, gently bringing them and developing the trust with them. The other person I want to talk about is our youth case manager. He had a client that expressed concern about getting some paperwork completed that she needed to have completed for training. She didn't have a family doctor and the physicians needed to be completed by a physician. And all the walk-in clinics were closed and she needed to have a face-to-face in order to get her paperwork done. So he had been able to arrange with one of his contacts at the hospital to have a psychiatrist at the hospital complete the paperwork for her. There was a fee involved. She didn't have any funds, so he was able to advocate through our wellness program to have the fees covered for her. And then she was very anxious about going to the appointment, and he had planned on going to the appointment with her at the hospital. But right now with COVID, you can't bring in anybody with her, but he was able to advocate through the hospital and the psychiatrist to be able to attend that appointment with her. So he attended the appointment and she was able to get her paperwork completed and she is able to complete her job training. So she's on getting trained and should be able to be employable very soon. So they're just two of the examples of the positions we have. I'll just give you an overview. The street outreach nurse, she works with the homeless and marginally housed population to support clients and maintain their mental health and their addictions. In collaboration, she works with home-based housing and the integrated care hub. The street outreach nurse seeks to engage clients through outreach nursing, including COVID-19 testing. She does mental health assessments and implements wraparound nursing care plans. So she is based out of the integrated care hub pretty much 5 days a week and connecting people on a daily basis. And then our youth case manager, he works with clients that are 16 to 24 who are homeless or at risk of becoming homeless, connecting them with services, mental health services and addiction service through a harm reduction approach, identifying goals that the client wants to meet and achieving them and helping them find stable housing. Mm-hmm. And I'm going to turn it over to Carol.
Mm-hmm. Thanks, Julie, and thanks for the opportunity for us to be with you tonight and your care for the community. It's these two positions we don't get ministry funding for or LIN funding for, and they just really allow us to reach the community in a new way. So we're very appreciative of that support. We thought it might help to. What's the impact of COVID been on those with addiction, mental health issues, those who already have challenges when it comes to coping? And really in a nutshell, it's been harder for them to access service, harder because many of the drop-in locations are closed. Many of the places that they would just hang out and be, they can't be there through lockdown, through reduction in people that can be indoors. We found the shelter beds have been reduced, had to be reduced because we have to do social distancing. Detox beds have been reduced because we have to do social distancing. As Julie said, it affects our clients because they usually have somebody accompanying them to appointments, and that's not always possible. So that support is hard to provide in this environment. There's increased substance use. I guess to all of us that would make sense, but the substance that they use is much more dangerous than COVID. You're probably regularly hearing about pink and purple crystals and fentanyl and carfentanil and all kinds of substances in our community that make it even more dangerous for this population. So there has been an increase in overdose. And I think it's safe to say everybody's mental health has been challenged during the pandemic. I'm sure we've all felt, oh, are we going to get through this? But it's even worse if you really struggle with that to begin with. Everybody's told to stay home, but if you don't have a home, then it's really hard to stay home, or if home's not safe for you. So one of the things the organization AMHS has been running with great support from our partners and the United Way, we have a self-isolation program for people who are homeless or precariously housed, who may have COVID or had exposure to somebody with COVID, and we help them to self-isolate for as many days as public health tells us to do. One of the things that United Way was able to give us was tablets, because if you spend 10 to 14 days in a room by yourself and you may not have great supports to begin with, something like a tablet is really a lifeline. They've also, I think 3 occasions now, helped us get burner phones for people. So disposable phones so that they can make appointments, so that they can connect to support, so that they can feel not as isolated. So these are huge supports. The other thing is we've had people really able to benefit from even toiletries that were supplied. So we're very grateful. These things, although, you know, we walk around with these things all the time, for our clients, these are not always, these are luxuries to them. So we really do appreciate those supports. One of the final things, because I think we're at our dying minutes here of panel time, was we've really learned a lot through COVID. So we're deemed an essential service, and like everybody else at the beginning of the March, the agency closed down. And when we opened back up again, we found some clients did really poorly with that. And so when we went to our second lockdown, not all services went home. We learned a lot more about PPE and how to deliver care effectively to people. And the programs that didn't close down are the one that Julie manages, like our case management, who go out and work with people in the community, are a sort of active treatment team. So that's our hospital on wheels. We manage a crisis service where you can call us, or we ride along with police. All those services have continued during COVID because they have to. The services that we've learned we can do virtually are counseling and treatment, and even our addiction programs. We now run groups virtually for addiction services, where that always used to be an in-person get-together group. So we've learned a lot about client need during the pandemic, what still needs to be in person and available, and what can be virtually. And I think that we'll take a lot of that with us and be able to enhance service, look for efficiencies, because certainly if clients don't need to travel to us, we can do more, and we can do it without having to burn up our highways or have clients come to us. So lots we could tell you about. Hopefully there's questions, and we really again appreciate your support and your interest in addictions mental health.
Thanks, Carol. Thanks, Julie. Just to give you an example, one of the things we've learned from the pandemic, in addition to the ones that Carol and Julie have talked about, is how well our agencies work together. They have to. So it's not just working with agencies, it's also working with the healthcare system, with police. It's really great to see a community come together, which is what they've done. To give you an example of what Carol was talking about, the Integrated Care Hub, that's something that the United Way is funding as well. Again, it was an emergency. It was something we've been talking about for a long time. How do we serve the most hard to serve? How do we do it in a way that's respectful and meets their needs, what they're ready for at that moment in time? And the Integrated Care Hub has come as a result of this, this pandemic. The staff at the Integrated Care Hub see challenges every single day, like Julie and Carol do and their team. One week, they reported that they had 40 naloxone interventions. That's a lot for staff. They're burning out. We're seeing an increase in the numbers for sexual assault counseling and for family counseling, domestic violence, but our agencies still have to continue to serve them. So it's just amazing to see how these agencies just carry on, finding the energy, finding the courage to continue to do that. One Roof, I know Tara used to work at One Roof with home-based housing. 60% or more of their clients are female. Many of them are in the human trafficking business. So again, we learned from Ashley, who was the manager, how much it was impacting their staff to have to deal with something like this every day. So again, self-care for our agencies is a luxury that they don't often take. They know that they need to look after themselves, but they often don't have the time. So with us today, we've got Kim Irvin Albano, the Director of Clinical Services, and Tara Everett, the Director of Community Services from Resolve. And they'll talk to you a little bit more about some of the counseling, including how they are looking at organizational health. So I'm not sure who's going first. Is it Kim or Tara?
Thanks, Pavna, and thank you so much for bringing this topic forward. It's such an important topic, and I am so thrilled. If there's, one of the things I want to continue after the pandemic is to continue talking about mental health. So I'm very, very thrilled that we're here and that we can just talk so freely about this topic. So United Way offers some really, really essential counseling support to Resolve. So Resolve is an organization, we're a multi-service organization. We offer supports to folks of all ages in many different programs. And our counseling programs offer supports for people who are mild to medium mental health needs. So Addictions, our partnering agency at Addictions and Mental Health are a really, really important part of the continuum, which really offers support for people who have more significant mental health issues and mental illness, and we're mild to medium. So one thing that people often are unaware of is for many of our community members, there's no financial funding for counseling. And so unless you have significant mental illness or addictions or abuse, or for instance, you might have an EAP program, many people don't fall into that category. And we at Resolve see many people who have a barrier of a financial barrier that prevents them from seeing counseling. However, with the funding with the United Way, we can offer them that support. We, since the pandemic has started, we have seen the type of counseling change dramatically. We see people for short to medium length in counseling, and we work with people on a variety of issues. Typically, it's anxiety and depression. We've seen more requests for marital support, where there's been some marital stress in the house because of the pandemic. And we've also seen an increase in people calling us because they're identifying as depression. Usually it would be higher for anxiety, now it's higher for depression. And so we've seen that self-identified as depression. So that's been an interesting change. And also we're doing what we call stabilization counseling. And so less about looking at some of the issues in the past that have impacted people, more about providing really, really good skills on how to manage the difficult emotions that people are experiencing. One of the funding resources that we've been able to access with the United Way support is something that's been very different for us. It's funding just for seniors for support during the pandemic. And this is something that we had a huge uptake on. And I took one call from a woman. She was over 75. I can't remember her exact age, but she called and she told me that she had never called for counseling. She's never experienced counseling before. And that was a new trend that we were seeing too. Many people were calling that had never called us before. This woman, what she shared with me on the phone is that she was feeling extremely sad because she was a very active person who would go out a couple of times a week and have her social groups, and she did some dinner at different people's houses, and she played cards, a couple of, there's Tuesday nights and Thursday night groups, and all of that stopped. But the thing that impacted her the most was that she wasn't able to see her grandchildren, and she was feeling that she was missing out on seeing those really important milestones in her grandchildren's life. So she was having some very big emotions that she was having a hard time managing. And I can't remember if it was her doctor or a friend suggested that she called Resolve. Those are the two places we tend to get the most referrals from. So I can't remember which one it was for her, but she called us, and when and this person was on a fixed income and had very limited resources. And when we were able to share with her that the United Way has offered some funding for us to be able to connect her with a counselor right away, she was thrilled. And we connected her with one of our counselors named Janet, who is really, she's worked at Fairmount Homes, worked with a lot of people, seniors, and she and Janet hit it right off, and we're able to have a few sessions. And she didn't come for a long period of time. She came for about 3 or 4 sessions, but was able to gain some really significant tools that helped her out. And so that's the funding that really makes a difference in people's lives. This woman was really thankful. And we also were able to offer some supports to a couple of seniors couples as well that had never accessed counseling before, but were really finding it very challenging for them because their whole lives have been changed through the pandemic. So I really want to thank you for all your contributions to the United Way. That's the kind of the outcome that we get to see in our day-to-day life. The interesting thing too is that the impact that the pandemic has had on people in general also impact the staff at Resolve, the staff at all organizations. And we at Resolve, we do a lot of workplace wellness as well through our EAP program, and we support a lot of organizations. And so one of the things that we did right on is one of our employees, Sarah, she dug deep into some of the research that was just rolling out. So by July, we're starting to have some research that really showed some of the mental health impact. And we were able to support many different organizations, but in the same time, we were learning how to support our staff as well. Interestingly enough, just as a little bit of a side note, one of the things that supported our staff the most was the United Way funding so that they could do the work that they wanted to do with people and to be able to say, yes, we can help you. And so that in itself was a huge support to staff. But one of the things that we really took a look at is, we know with resilience, there's really 3 key factors that increases people's resilience, including during the pandemic. So there's the ability to have really pleasurable activities, that's part of it. There's the ability to engage in really meaningful activities. And there's the ability to kind of lose yourself in the flow. That could be with meditation or yoga or dance or art or music or walking in nature or fishing, whatever is your thing, but just to be able to lose yourself. And what the pandemic did is it took away that pleasure part of it. And that's a place that a lot of people will found their resilience and their wellness. So there are no more going out for dinners or going over to a friend's house for a drink. And so those pleasure, or going down south, right, during the winter. So those pleasurable activities were really either eliminated or reduced. And so our staff team were feeling that. So we really focused on the engagement. And so in the team meetings, we were talking about what are you doing that's engaging you in life? What is getting you interested in life? And staff were sharing ideas. And they could be ideas like, you know, I started doing adult coloring books. It didn't have to be really complex. And we heard about staff team members going for morning walks with people, or going on bike rides with their teenage son, and doing lots of really meaningful activities and finding new ways to engage. And so that's one way that we as a staff team really learned how to support our own mental wellness while we're supporting other people's mental wellness. It was really it was a really important activity, because what happens then is we have that lived experience to share with our clients. And as clinical director, I still like to take on a very small caseload just to keep my feet on the ground. And I think I have 5 active clients right now. And so one of the things I was able to share with my clients is how I'm engaging. And you know, one of the things, I have my knitting right beside me here, right? And so how I took up on knitting a little bit more, and to find things that I'm really engaged in. And we found as a staff team, we were meeting in the at the very beginning, we were meeting in the mornings on Tuesdays and Thursdays, and talking about some of the ideas that we're having, and we're continuing to have those conversations. So those are the things too that we're also noticing in our organizations that have been helpful to increase the resilience and increase people's wellness in their workplace activities. If you have a chance to take a look on our website, we did post a video on our website about managing isolation through COVID. So we're also doing some reminders. Sometimes it's new information, but often it's a reminder of the things that we need to take care of ourselves. And the other thing I would say that is something that's really helpful, that we've been implementing ourselves, but also to be able to share with our people that we work with, the organizations we work with, is you know, everybody that I know who has heard of Brene Brown loves Brene Brown, but she's really shifted the language around our self-care, self-nurturing, and our gentleness. And to remember that some of the feelings that we're having are a normal feeling for an abnormal situation. And to remember that kindness and gentleness with ourselves and with others. And we're really trying to practice, and I think we're doing a pretty darn good job of practicing that as a staff team, so that we can really support each other, so that we know that even though we're all working in our homes here and we're feeling isolated in our homes, we can connect together to make sure that we're working to support our clients with as much support for each other, and to remind each other and ourselves of that kindness and gentleness. So we're working really hard with organizations, with clients, to really increase the resilience, to be able to remind people that that we're just a phone call away, and there's no shame in picking up the phone and asking for help. And we're really thrilled to receive the support from the United Way, to be able to say yes to clients that we can help you. We've seen an increase in need We've seen an increase in the type of distress that people are feeling. And so thank you very, very much for your contributions. And we're gearing up for knowing that this is going to impact us probably for the next couple of years. And so we're really gearing up for that, and to know that so we're here and we're hanging on, and we're ready to support folks. So thank you very much.
Thanks, Kim. Tara, were you going to add something?
Yeah, I was just going to add thanks. That was very thorough from our speaker so far, and from Kim as well. So I will just add, I just wanted to give a little bit about the youth perspective and share a little bit around our youth programs and how the United Way helps resolve with some of their youth programs. And so basically, I thought I would just kind of share some of the challenges of staff and youth that we've been facing trying to engage young people through the pandemic. And as you can see through a lot of Kim's feedback is, you know, if people who are relatively you know, stable in their lives, really struggling through the pandemic, as then, you know, young people and more marginalized populations, certainly, how are they being impacted by this as well? So I think for what it's been very challenging to engage youth virtually. And I think some people might find that surprising, thinking that, oh, young people are on technology all the time. But some of the barriers have been technology itself. So I know the United Way has been fantastic at getting technology to those clients that need it. And so many of our youth have accessed the technology provided by the United Way, but then they run out of data, or they're not around Wi-Fi, or a lot of times they might kind of make up what we see it could be excuses. But I think what we're hearing is they're like everyone else. Like we're struggling with online fatigue, Zoom fatigue. And I think for youth, they really identify their devices with their social activities. And so it's been really challenging to engage them in, you know, work such as school or counseling appointments. So what we offer at Resolve is, so we do have a youth case manager who really focuses on life skills and housing support for youth 16 to 24 who have been or are in care with Children's Aid Societies. But then our clinical counseling, which is United Way, helps provide support to our youth outreach counselor. And that has been a fantastic role in helping to meet youth where they're at. So pre-pandemic, the youth outreach counselor was going to places like One Roof, Rise at 149, and it was very successful, and it still is. But when we shifted to virtual, the engagement for youth certainly declined. The youth didn't want to engage in therapy type appointments on a virtual basis. And I think some of the reasons for that is part of the reason we developed that youth outreach program was because we know youth focus on relationships. And so the more they, sorry, I'm laughing at the cat, sorry, Kim's cat behind her head. The more they, you know, get to know somebody, then the more apt they are to engage in therapy and counseling. So just by even hanging out at One Roof, the youth outreach counselor was able to develop relationships. So eventually then young people would be able to initiate counseling appointments. So that's been very challenging, and we're very now we are moving forward to back to in-person appointments. So we are very looking forward to that, because it's going to be beneficial to the youth and to the staff as well. Resolve also offers a walk-in clinic. Now that has moved to virtual. That's another program that the United Way funds, and that gives easy, instant access to counseling appointments and free counseling appointments. And the youth outreach worker will be attending those as well moving forward, as well as subsidized counseling for children, youth, and families across the board. The United Way subsidizes. So, so I can't emphasize enough. And just on a personal note, you know, I've only been at Resolve for 6 months. And prior to that, in my different positions, I've worked with the United Way for many years, and they not only support, you know, people and agencies financially, but I feel now it does help that we're in the same building now, but I feel like, you know, you can call Pavna or Kim and you can brainstorm with them. You can pick their brains. You can say, we're really dealing with this. And, you know, they're going to come up with some solutions and find, you know, whether this is happening in the community and identify, you know, they identify the barriers and the ability to be able to have the funds to address some of those gaps and barriers. Because as Carol mentioned, you know, a lot of times organizations are stuck into their mandates, and they're really driven by ministry funding. And so the United Way funding really allows the opportunity to broaden that and support those clients in need. So thanks.
Thanks, Tara. Yes, it's great that you're now down the hall from us when we are in the office, but thank you. And it's amazing to see the agency, how dedicated, passionate they are, the work they do every single day. I don't know if I can even express how humbling it is to watch this community in action with these amazing people who just jump to it and find a way to serve the most vulnerable in our communities. Thank you to all the agencies. As I said, 220 programs through 70 agencies last year. That's an army of people just working to make sure every day people are fed, that they are housed, that they are provided support. So thank you to all the agencies out there. We're going to move to Jen Cameron. Can you wave wherever you are? Yeah. So Jen Cameron has been a designer with us, and Jessica or Megan are going to start to show you some of the work. And I'll just talk while that's playing just to save some time. But what we've learned is that children and youth are particularly impacted by the pandemic. So we heard from a number of agencies that they were concerned about this, including the Queen's Psychology Clinic. So we've worked with the city, public health, the psychology clinic, and some of our agencies. And Jen has, Jessica, are you going to play that?
Sorry, it gave me an error, so I'm just going to try it again.
Okay. The wonders of technology. So we've taken, what Jen has done is taken our award-winning, or her award-winning Success by 6 campaign, and we're adapting it to help people with young children on what they can do to help children's mental health as well as youth. And so as soon as Jessica is able to play it, we'll show you that. Are you able to do that, Jessica? So Jen, I don't know if you want to add while this is playing, if you want to mention your thoughts when you were developing this.
I guess just this one is kind of from the kids' perspective to their parents, to try to encourage them to do some of the things that are still allowed. And we were just speaking with public health to determine what those things are that they can still do even during the pandemic. And then it's going to lead right into the youth one, which is has similar look and feel to the youth homelessness campaign that we've done before with United Way. There's no sound because it's going to be on social media, so it's just going to be as people are scrolling, they can. We're hoping the movement of the ad catches their attention, so that they pay attention for a little bit longer.
And one of the things we've learned that Canada was already lagging behind in terms of child well-being, children's well-being. And this is before the pandemic. So we can only imagine now the outcomes of what's happening right now. I know our agencies are monitoring it closely, but again, it's really important that we're all sensitive to the fact that children and youth don't always know where to go. And they don't often appreciate that there are others going through the same thing that they're going through as well. So just helping them, you know, with how they can help each other, the parents with some ideas on what they can do. So we're really grateful. And this is just the start of a campaign, but we just thought we'd share this with you. It's still not finalized. We're just going through some learnings as we're developing this.
We also wanted to have a spot where maybe the teens can share what they've found help them so that they can give advice to other kids because they like to do that. So
yeah, so we'll watch for that campaign. It'll come out and hopefully it'll help families dealing with this and youth. I'm going to turn it over to Leanne O'Mara, who's going to talk to you a little bit about Tampon Tuesday.
Thanks, Pamna. And thanks, Jen. It's so nice to see those images. They really ring home and share the impact of what kids and youth are going through. That was fantastic. I get the pleasure today to talk to you about Tampon Tuesday. So yesterday began our second annual donation drive towards Tampon Tuesday. We had our first one last year right before the pandemic hit. And I think it was very, very successful. For our first year, we were able to collect over 45,000 pieces of menstrual hygiene products. And so we're hoping to capitalize on that and grow that number this year. We have a number of collection places where you can drop off donations. We're also encouraging everyone to start a collection with their neighborhood, workplace, families, and friends. I know I've done that at my workplace and I've had some really great reactions. Mostly people are not aware that it's a thing. People are not aware that food banks and different agencies need menstrual hygiene products. So it's even just bringing awareness to that. But they really are one of the most requested items at food banks, shelters, and agencies, and one of the least donated. So we're shedding some light on that, collecting as many as we can and distributing them to our United Way partner agencies. Another exciting way you can donate this year is obviously financially through the United Way website. You can specify your donation to go towards Tampon Tuesday. And we also have an Amazon wish list, which is a really cool way that you can be on Amazon, order up some menstrual hygiene products and ship them right to the United Way. If you want to just do a collection this year, we have a number of drop-off places. So obviously the United Way office is one place where you could drop off donations. We have all Shoppers Drug Mart locations in the Kingston area, as well as the 2 Cher Mare spa locations. And if there's any others I'm missing, they are listed on our website as well. Oh, Secura Financial. How could I forget Pat and everything he does for us? So yeah, that's running from yesterday, March 2nd until March 16th. And it's a really small, for most of us, it would be a very small thing that will have a huge impact to our community vulnerable. So if there's any questions, I could take that. But other than that, thanks for your time.
That's great. Thanks, Leanne. Yeah, it was exciting last year. So hopefully it'll be a great campaign again this year. So I just wanted to take a moment before we go on to the question portion, just to really thank quite sincerely each of our speakers for taking the time today and for sharing with us. It really is your stories and the work that you do that keeps me coming back, and I think probably everybody else as well. So thank you for that. It really is important. And Jessica sort of spoke at the beginning when she was doing the introduction about how successful we as a group have been in terms of our numbers. And the part that she didn't share with you that she left for me to do was that in 2018, Women United as a group raised, either individually or with partners, $957,000. And here we are, 2020, and we raised $1.4 million as a group. So yes, it's really, that's amazing, and really speaks to, I think, the commitment that we all have to our community. So that's fantastic. And thanks for showing up and for making those donations. And I think we're just going to go over to questions at this point in time. So hopefully you've got some questions for our speakers for the United Way.
And you can just shout out the questions, or you can put them in the chat, whatever you prefer.
Kim has this. Yeah, go ahead, Kim.
Hi, thank you, everybody. That was excellent. I enjoyed all the information. I apologize for this one here.
Love the dog.
This may seem like a common sense thing, but I agree. I think it was Kim who had said that you guys are kind of preparing for the next couple of years. But I'm just wondering, with weather-wise, like how you see things changing with, hopefully, knock on wood, nicer weather coming soon. Does that increase or decrease? And I guess this question is for everybody, because I know with Bell Park last summer, you know, I'm a little ignorant as to a lot of the information there, but I heard, you know, I watched a lot of it, and I heard a lot of them saying that they prefer to be outside. They prefer not to be regulated. So I'm just wondering, you know, kind of what kind of barriers that has, sorry, for you guys, and with working with people when the nicer weather comes.
For us at AMHS, it won't really change much. Maybe the location of the people will change, but we'll still be outreaching in the community. So maybe there won't be as many people at the integrated hub, and they maybe go back to camping, but we go into the encampments and that, so it won't change a lot. It will just be more the location that will change for us.
I would just add, one of the really challenging parts of not only Kingston, but cities everywhere, towns everywhere, is the affordability of places to stay. And as well as clients really learning, having the skills and the comfort to live in homes. So I would agree with Julie. I don't think much is going to change in terms of those needs. We're happy to continue to work with partners and continue to advocate for change and the services that this community needs. So,
Kim or Tara, did you want to say something from Resolve?
Typically, whether we're in a pandemic or not, January to March is our busiest time and most intense, when we have our darkest months. And so what we tend to see from year to year is that once the spring comes and the sun comes out, that we have less people calling for services, and we predict that will happen again. But the reality of what that does is, because we have so many people requesting services, that we never have a gap. We're always, we never have a gap in caseload. But what it would mean is that people could come maybe every second week rather than having to wait 3 to 4, and it will help us to move people off of our wait lists, because right now we do have wait lists. We've tried to eliminate them, and our walk-in clinic is helpful in that. But our walk-in clinic for the last 3 weeks has been so busy that we've been at capacity, and we've had to book people in on other days. And so we anticipate that what will help is just us to be able to offer, you know, service a little bit better.
Okay, thanks. Janet, Lee put a question in the chat that I think she'd like both agencies to answer. Sorry, I didn't know someone else was speaking. What have you learned about service delivery that your agency will want to continue post-COVID?
you want to start this time, Kim, or?
Oh, sure, I can start. We have been thinking about increasing our ability to be able to access people remotely for a couple of years. So the pandemic really helped us to really jump in with both feet, and we were pleasantly surprised that the clients were able to engage with their therapists as closely as they have. We do have a measurement that we use to look at the engagement, and it was equal to for many clients to being able to engage in person. So what this did is it eliminated some of the barriers for some people. It added some for some folks, and it eliminated some for others. So we suspect that we're going to continue with remote counseling in the future, and to be able to have that really client driven about how they want to access us, and we'll be much more open. So we've worked really hard at getting what's called HIPAA compliant video counseling, because we have all these rules that we have to follow, and so we have that all in place, and we're going to continue with that. And so that's one of the aspects for sure. We've been able to access some of our groups online as well, and we work with both mandated groups and also volunteer groups as well, and we're noticing that we're able to engage some folks from up north much easier, and so that's something that we will certainly consider as well.
Thanks. Carol, did you want to?
Yeah, and then Julie will chime in. I'd similar to Kim is that we've learned a lot about how to deliver virtual care, and have some clients we too evaluated it, and had some clients that prefer that actually, even when they were able to return to office visits, said, no, I'm going to stay with virtual. We've had less missed appointments for some clients just because the travel has been eliminated. So we've also figured out how to support workers working from home. So I think that it's good news, because mileage is expensive, and you know, we're saving our environment if we don't have to drive, and you can actually potentially have more people seen because you don't have to travel in between. So that's certainly something that our organization will continue afterwards, and try to figure out that balance. On the other hand, I think staff have suffered when you're always working from your home. There's a need to come together once in a while and still be able to see one another and have some interaction time. I think we've probably all become really attuned to reading body language on Zoom or Teams or whatever, but there's nothing to replace actually, you know, being in the room with each other. So I think it'll be a combination when we're able to do that, when that's feasible. What I missed, Julie?
No, that was pretty much what I was going to say. Yeah, so with the virtual, it's been able to provide more options for our clients, especially for the rural clients, where if it was a snowstorm, your appointment was typically canceled, where now we can go virtual. So we have a nice balance to all our clients. So it's worked out quite well. We realized, like Carol said, some clients don't do well with virtual and some do better face-to-face, but now we have a nice option. If we physically can't get there, we can do a virtual appointment with them, which is fantastic.
Okay. It's Julie Parker here. I would like to know about the status of human trafficking. Are you getting referrals, and from whom are you getting the referrals?
Julie, that might not be the scope of the agencies in the room, but there is a group working very closely, the Sexual Assault Center, Interval House. I'm sure that they refer counseling to the agencies, but we can certainly get you an update on that. There's a whole task force working on that. We'll get that maybe for next time. Yeah.
Thanks, Pavna. Thank you.
There's a question for Kim from Nancy. When you talked about a wait list, what kind of timeline are you talking about?
So the timeline, we've been able to really significantly reduce our waitlist timeline. So right now we're looking at a 2 to 3 month waitlist, which is much better than we had an 8-month waitlist at one point. And so I really want to be really very excitedly share this, is one of the reasons why we've been able to eliminate our wait list is because of our clinic, which is funded by the United Way. So our purpose for asking for that funding was because of the wait list, because people need counseling when they call, and so that's wonderful. And so we're really doing our best to keep it as low as possible, or not to not exist at all.
Okay, thanks, Kim. I didn't see any other, are there any other hands up? Because I do have a question. Oh, okay, there we go. Marianne, go ahead. Oh, you're on mute.
There we are. Okay. I would like to ask, going back to Martha's Table and to all the other ones as well, maybe not so much resolve, but from our group of women, and maybe there are more in our group who are not at this moment on screen, except for financial support, is there also a way to help manually, shall I say? I mean, manually, for instance, as a volunteer at Martha's Table, or well, not with you, Kim, probably, but something that we can do on a regular basis, not as a little rich lady who's jumping in for one Monday to serve at Martha's Table, but on a sort of regular basis to to help in some way. Or is it better than to go just to your United Way office and look there for whatever?
So Marian, there are volunteer opportunities. So certainly helping with meals, all the meal programs are using volunteers at different times. There's a lot of need for drivers to deliver. So even Martha's Table has started delivery service, and our food boxes, seniors food box that we started, and the good food boxes, they always need drivers. Mm-hmm. The one area that I think a lot of women can also help with is on boards. Our agencies are really struggling to get board members, and good board members. So the stronger the board, the stronger the agency. So I think if any of you are interested, again, feel free to call me and I can place you in an area that interests you. But that's what we do. We also run the volunteer center. There are some jobs posted, but if someone comes to us, we'll always find a match that works best for you.
Thank you.
I have a question for both agencies. You've explained wonderfully how well you pivoted with COVID and in different ways, engaging in person still in some cases, engaging virtually. Who might still be falling through the cracks? Who are you still really worried about?
For us, it would be that very isolated person, maybe at home, that's not reaching out, that's really taking COVID and isolation to the extreme, where they're not connecting, maybe becoming depressed. So we're actually trying to lean more on Frontenac Housing. We're meeting with them once a month to see if they can identify anybody that maybe their maintenance lets them know about someone that's not doing well. So we're doing some reach out there, or just those people homeless people that have been banned from everywhere in the city. Quite concerned about them as well. Those people are falling through because their behaviors at times have gotten them banned from everywhere.
Mm-hmm. Yeah, and I would add to that. It's we don't know what we don't know, right? And it would be probably the more marginalized people that relied on in-person places pre-pandemic, so drop-ins, food programs. Even within our agency, when the doors have been closed and it's by appointment only, prior to the pandemic, there was lots of people that would drop into 417 and maybe touch base, or we'd be able to redirect. So yeah, I worry there's still a lot of people falling through the gaps out there, but it's hard to capture them at the same time.
And Lori, if I could just add to that, both Kim and Julie and Tara made really good points. One story I'll tell you that I just heard about last week was a 60-year-old man who showed up at Lionhearts, was standing aside, he'd never accessed a meal program, didn't know how to start. When they started talking to him, they realized that he'd lost his job. He's 60 years old. He's homeless because he hasn't been able to pay his rent. He's got no income, but he's never reached out before. So he doesn't know where to go. And the beauty of this community, I have to say, and I don't see this in all the communities across Canada that we talk to, is that everyone got together, found him housing. The United Way started to fund an overflow shelter with 6 beds. They found a way to house him. Again, he'd never been in a shelter before. He didn't know how to access that. So getting him into a place where he would feel comfortable and not in the big shelter where he'd be uncomfortable. So they actually moved someone from this overflow to another place so he could actually be in a safer, more protected place. But those are the kinds of stories we're hearing. And what we're trying to do is really reach out so people know that there's help when they need help. So again, one of the things that we're starting with the city is a resource on the web, which Jen is designing again, which is going to help people. So if I know someone who's homeless in my vestibule, where do I turn? So we're going to start that resource as well. Because there are a number of people who, we also know that there are a number of people who, like veterans, who are able to live out in the open without accessing support. And the more we can help them. I know there's some really great people who are starting these, putting people in motels and stuff, and that's a great idea. But what they're losing is the connection with agencies like Carol and Julie's agency. So we encourage people to be part of the system, because the system is really what caring people, helping people. And I'd encourage you really to work with what we've got and help enhance it, rather than creating these offshoots that leave people unsupported in so many different ways. So just a roof over your head is not enough. It's really having the supports around you, right, Carol?
Yeah, no, it's very true. Everybody needs a sense of community. Everybody, you know, we found people just finding them housing without providing other supports and connection and how to manage within that house. People don't do very well. They return to being homeless because they don't know how to survive there. So yeah, there's a lot more to it. Yeah. I really appreciated, sorry, Kim, the artwork from earlier, because I do think, like Tara, there's folks out there who talk themselves out of their mental health needs, or say, you know, I'm sure it's just me. It's just, you know, and the sooner you can get help and feel like I'm not alone, and this doesn't have to be a big scary thing. I can get help. We're really trying to work also with primary care and nurse practitioners to really connect people to care. Doctors are often very worried for their clientele and want to connect them to care. So we're trying to formalize those networks as well, to really have them know where to turn. And often if your doctor says this would be a good thing, you know, their clients will do it. So anyway, sorry, Kim.
No worries, Carol. A little bit of a different angle on this question. One of the things that we have our eyes on as well is because we do have a financial counseling aspect to our program as well. We're aware of the financial stress that people are in, and how much that affects their own mental wellness as well. But what we're seeing is that because of the uncertainty of the pandemic, people are waiting and waiting and waiting to get help. And so folks who might have come to us for some debt management support are waiting because they want to be able to support themselves, and they can't give up their credit card or whatever it is. So one of the pieces that that we really are wanting to support people with is their financial wellness, and we're really worried in the future about what that's going to look like for people. And we were really glad that we just were able to secure a grant particularly to help women who've experienced intimate partner violence with some of their financial counseling. And so we're really, really thrilled about that, because we're seeing the impact of the pandemic on people's finances.
Yeah, thanks for sharing that, Kim. And I just, wanted to add that financial stress ties into, it's all a continuum. It ties into the mental health and the mental stress. And we had a counselor a couple weeks ago share a story where a financial counselor, a woman was disclosed that she wanted to take her own life, and because of the impact of her finances. And so our financial counselor was able to talk this woman down and connect her to mental health services. But it all ties together, right? Especially right now with the pandemic.
Okay, thank you. Thank you. Any other questions? Okay, I don't see any others. If I've got your hand up, wave it higher and harder. Okay, I think I'll turn it over to, is it Bhavna, Jane, Jessica? Who's going to?
I think Jane's
Yeah, I'll
ready.
just say our goodbyes now. So it's clear again, so thank you to everybody. It's clear from just even the questions and answers how much more work is still to be done, and that we are not through this by any means. So that is really clear. And again, I just want to say, I always have this theory that if you really truly want to see what you value, you look at your day timer and you look at your bank statement. And with this group, it's clear from the time that they commit to the community and with the dollars, this was a year where the community really did need us. And I've heard from some of you that you heard that through these sessions, and that you sort of went back and you dug deep, and our numbers show that. So that's really awesome. And then I guess just in closing, my hope is when Kim was talking about sort of the 3 ticks for resiliency, that maybe our session tonight ticked a couple of them. I know that the dog brought me great pleasure. So thank you, Kim. I think it might be dinner time for that dog. But that was pleasure, and seeing all of your faces and Julie with her glass of wine. So certainly did pleasure for me, and I think engagement too. And then possibly even flow for some of us. So that's all in a wrap from us. We will be sending out a survey, and we do really welcome your feedback. We listen to it, we adapt, we try and do more of what you want and less of what you don't want. So if you've got a few minutes to fill that in, please do. And to all of our agencies, just thank you so much. And thanks to the United Way.
Thank you all.
Thanks very much.
Yeah.
Be well.